Dr. Paul Marik exposes the truth about chemotherapy, and you will not hear this from your typical oncologist. Dr. Paul Marik, a renowned critical care physician, has shed light on the harsh realities of chemotherapy's ineffectiveness in treating cancer. He revealed that only about 5% of all cancers are actually curable with chemotherapy. This small fraction of cancers that are chemo-responsive includes testicular cancer, Hodgkin's lymphoma, acute lymphatic leukemia, and a short list of others. You can see that image linked on the Vigilant News Network. We encourage everyone to go and have a look. For the remaining 95% of cancer cases, the prognosis is far less optimistic. Dr. Marik stated chemotherapy is palliative at best, highlighting that while chemotherapy might prolong survival by 1 or 2 months, it comes with a significant cost to the patient's quality of life. The treatment often leads to several severe side effects, and you can see the list of some of those there. Just absolutely astounding. The truly sobering detail that Dr. Marik mentioned was that despite advancements in chemotherapy, immunotherapy, and surgical treatments over the past 30 years, the overall life expectancy of a cancer patient has been extended by a measly 3.9 months. Take a listen.
There are about 5% of all cancers that are actually curable with chemotherapy. So that's an important point to make. So what I'm not saying is no chemo at all, but there are certain tumors, such as testicular tumor, certain lymphomas, certain leukemias, choriocarcinoma. So there are certain tumors that are very chemoresponsive, and patients can be cured with chemotherapy, but they make up about 5%. Chemotherapy is palliative at best. So what it does is it may prolong survival 1 or 2 months, but it does that at enormous cost to the patient. Enormous suffering, enormous side effects, hair loss, nausea, vomiting, neutropenia. So what the chemo does is it goes for dividing cells. So it knocks out the bone marrow, so the patients become immune paresed and at risk of infection. It affects the dividing cells in the GI tract. So there's an enormous cost associated with chemotherapy in patients who have diseases that are not particularly chemoresponsive. Chemotherapy is palliative rather than curative. And that's a very important question. So the patient must ask the oncologist, the chemotherapy that I'm getting, is this going to cure my cancer, or is it just going to palliate and extend my life a month or 2 with terrible side effects? And hopefully they'll be honest. So if you actually look over the last 30 years, this was a recently published study, despite the advances in chemotherapy, immunotherapy, surgical therapy, the life expectancy overall of a person with cancer has been extended 3.9 months.